Cardiovascular disease continues to be a leading cause of death in the United States, but you may not be aware that up to 80% of cardiovascular disease is preventable. Dr. Thomas Boyden is the Medical Director for Preventive Cardiology and Cardiac Rehabilitation at Corewell Health. And during Heart Month, he is here to talk about the ways that preventive cardiology might benefit those who have cardiovascular disease and those who are at risk for developing. Dr. Boyden, welcome. Thank you for being here with us.
Thank you for having me.
So who would be eligible for a cardiology program?
Really anyone. You know, like you said, cardiovascular disease is the #1 problem in our country and worldwide. And so many people are living with the risk of developing heart disease and the complications of heart disease. So what we're trying to do with preventive cardiology is not wait for you to have a heart attack or wait for you to have symptoms that suggest that you have it, but find it, detect it early, treat it early so that you don't have those problems. You don't need to go to the cath lab, you don't have a heart attack, you don't have a stroke.
Yeah, how can a program like this, help with those conditions?
Absolutely, absolutely.
So tell us a little bit more about this wellness program.
So we do a number of things within preventive cardiology. There's a whole team of us, so it's not just me by any means. There's me, there's a nurse practitioner, we have a whole team of exercise specialists and physiologists who are also health coaches. They are the ones that are kind of running our cardiac rehab and metabolic wellness program on the day-to-day basis. They work directly with the patients. Because of their health coach training, they're really just tuned in with how the medications work, how exercise can work, how diet can be improved, all to lower cardiovascular risk. So metabolic wellness is really aimed at people who are at risk, who haven't had complications from heart disease, that we are trying to kind of retrain them in their day-to-day habits and get them focused on the healthy habits that make sure they don't develop it.
Let's talk about stress. What are the links between bad habits and the impact on the heart?
Stress is a major driver of cardiovascular disease. It's very hard to quantify because there's not really biological markers that we can kind of routinely test to say, oh, you have a high stress level. There are certain things that we could check, but they're relatively non-specific with regards to what is triggering that response in the body, so you can't necessarily say it's stress. But stress often leads to bad habits like overeating, being inactive, maybe drinking too much, maybe smoking if you used to be a smoker. And so it leads to a lot of the habits that really contribute to the risk factors like high blood pressure, high cholesterol, high blood sugars, that can contribute to heart disease directly. So
what are some good things people can do to reduce that stress in their lives?
Honestly, there's so many different things that can be done to reduce stress, and really it's a matter of picking what works for you. It's hard for me to tell any individual this is what you should do, but certainly exercise has always been a way to really help reduce stress. We can see that even in the sickest of our patients, even in our heart failure patients, we know that when people are exercising, their stress hormone levels decrease. The body's response to those hormones being released improves, so they have better heart function and better response to when their body is under stress compared to when those stress hormones are always high. And that's true for all of us, but when we see it in the sickest of sick, we know it works in those of us who aren't. And so, exercise is excellent for it. Things like meditation are great. Getting into nature, just taking walks or hikes in nature and getting detached from all of the electronics and social medias and everything else is really, I think, very important.
Doc, can I ask, what are you doing at home? How are you keeping your heart healthy? What's your go-to?
Well, I exercise most days. I have kind of like my 15-minute routine. It's kind of more like a high-intensity 15-minute training. And then I have a group of people that I have been playing soccer with for more than a decade that we get together on the weekends, and I spend about 2 hours on my Saturday playing soccer. So.
Okay, cool. Yeah. Any other programs you want to mention?
Yeah, I mean, all of our programs, like I said, are not only available here in Grand Rapids, but in the greater area too, where all of our other kind of satellite hospitals are. So you can go as far north as Ludington to see these programs. And our cardiac rehabilitation team, they lead up our cardiac rehab, our metabolic wellness, our peripheral arterial disease program, our POTS exercise program. And so and POTS is a thing where when you change positions, your heart rate goes really high and you feel really weak and dizzy. And we saw a lot more of that after COVID because of the body's response to the infection. This is a known phenomenon. We don't know what drives it, but it happens quite frequently. So we're running all of those programs throughout Western Michigan. So wherever people are living, they have access to those.
Awesome. Dr. Boyden, thank you for being here with us during Heart Month. We appreciate you.
Thank you.